The third and final part of insulin preparation and validation is doing the long acting, which is your basal insulin, and that is usually given once a day because it goes into the system and it stays, it plateaus, it does not drop. Therefore, it is not necessary to get a blood sugar when you're giving a long acting insulin because it does not affect your blood sugars when you give this insulin. Now, the insulin can be Lantus or it can be Levemir. Both of them can be given once a day, but some of them can also be given twice a day. If you're giving a large amount of a long-acting, you might want to split it to morning and evening. Levemir is one of those that you would automatically split because its peak is usually around 18 hours, so they usually will split it in a 12-hour. Because Lantus does not have a peak, it lasts in the body for 24 hours, but we do see some drops in it once in a while. So in this case, this patient has Galargen Lantus, 56 units. Well, that is more than the low dose, so I'm going to get me out a standard insulin syringe, which is still considered precision, but it is not as precise as the lower dose insulins. And I'm going to get out my bottle of Lantus. Of course, I've washed my hands in preparation. I know I'm going to be giving 56 units. I do not need a blood sugar. I pulled my Lantus out. There's my first check. It expires 01 of 2021. Lantus 100 units per cc. Lantus Galargen, I'm going to give 56 units. There's my second check. So I'm going to then, like before, clean off the top for 30 seconds. Let's say 30 seconds has passed. Draw up my 56 units of air. Place that into here, being very careful because these needles are so small they can bend easily, and if they bend, you have to restart all over again. Put the air in to displace. Draw up 56 units gently. I've got a big air bubble, so I'm going to have to draw out a little bit more so that I can get rid of that air bubble. Moving my air, which goes to the top. And then I'm going to 55. Oh, I went past my spot. Since I went past my spot, if I have not touched this and I'm still here using this, I might just want to wipe the top off briefly, put the needle back in, drop back up a little bit more, remove it, make sure there's no bubbles, and there. Recap. Take these two to another nurse. You must always take the insulin, like in the previous one, and the syringe, because the nurse does not know what is actually in the syringe. It could be anything. She wants to know what you put in there. So you'll take the bottle at the same time with her. She'll look and say, Lantus 56, or Galargen, 55, 56 units, Lantus expires. This is you're giving it to this patient. She has done the second check. Again, she will sign it or he will sign it. Your third check. You can then put that away. So you go to your patient's bedside with your insulin and an alcohol wipe. You talk to your patient. Where would you like to have it? It's the same patient, but now it's in the evening. You've had them all day, taking care of them. You still have to do your identifiers. What is your name? What is your birth date? What is your allergies? You clean your hands. You wear gloves. There was always a question, why do you need to wear gloves when you're giving injections? Occasionally, secretions, blood might come back out of the site when you give it. It is a safety precaution. It's not a safety for the patient, it's a safety for you. Again, You find the site you want to give it. So today we're going to give it in the right lateral arm, or the right deltoid right arm. We're not actually giving it a muscle. You give it in the area, so you have to be very careful if you're saying deltoid. Remove your cap, find your area, 45-degree angle, stabilize your needle, inject it. Remove it. Do your safety cap. If you are removing it and you have a sharps box in the room, you put it in there. If not, you may remove this by walking out of the room. But before you leave the room, remember to remove your gloves, wash your hands, take the needle with you out and put it in the sharps container to dispose of it. Then you return to the chart. You would sign your name and the site, and we gave it in the right arm, so we're going to use a 1. Therefore, we have done the final documentation that we have. So let's review. What are the 8 rights? The right patient, the right drug, the right dose, the right route, the right interval, the right documentation, the right reason, and of course the 8th is the right response, which requires that you go back to check on your patient. This is your validation. Thank you very much for watching this video.